This is a simple one. We're really just looking at the upper arch, and in particular we're looking at the sinus, and we are looking at the facial restrictions that we have with that facial bone, and we are also looking at how the bone constricts around a tooth, which makes it very difficult when you actually extract a tooth. So these are three reds. The sinus comes right into the bone height here, and we have an outcome that I'll show you with an implant in at the end to show you what a sinus lift actually helps achieve in getting an implant into a minimal bone area such as this. But the facial constriction is very difficult to deal with, as well as that facial bone. So let's quickly look at that sinus, since that's pretty easy to do. Oh, actually we have it on, here's the constriction facial problem that we're going to see is this area right here in the front is extremely thin. So that's the facial bone red. And if you don't try to graft this, which you should, if you're going to do an extraction and think about an implant, even if you don't, you should probably think about putting a graft in this one, that all of this collapses away and this is the bone that you're left with. Well, that's not even close to where and what's supposed to support the tooth. Now, the constriction part of it is where this curves in and this curves in, and now it constricts into that area, making it very, very difficult to actually restore. And what happens when you have constrictions is it comes closer and closer to the roots as you go back, and now you can see as we go back into a premolar area, that constriction really affects how much bone is actually at the apex of the root here. When you start getting into the maxillary sinus and you get into this type of tooth, when you extract this tooth, you're really in trouble because all of the bone pretty much collapses away. So all of the teeth in somebody that has a real tight constriction or a thin facial plate of bone needs a graft for sure. And that's if you have a situation where the patient's going to do a bridge anyway, it's still a good idea because it will hold the ridge in that tissue, so it still will have less of a defect right at the gum line where the pontic meets the gum line, and will trap food less. So, okay, now let's look at the sinus on this side. Now that we looked at the facial bone and the constriction. So here's how much bone we have, and this is the same idea that we had from when I just talked about when you extract it and you don't do a graft. This is what you end up with. You end up with a very difficult situation, top and bottom. You can see it's a little even spiky at the bottom. There's no bone there. But looking at this particular area right now, we're right here, and we're going to start going forward through here, and you'll see that there's really nothing there. That's the ideal spot for the implant. And so that's where the implant should go. You probably only have 2 millimeters of bone here. If I go to the outer reaches, you're not doing much better. That's towards the front side of that site. Maybe you have about 4, maybe 3 to 4 here. That's not too bad. And then if you go all the way to the back area, I think it's a little thicker there, and now you're looking at about 3 millimeters. So let's take a look at this site now. This is 2 years ago, year and a half ago, and let's see what we did with an implant in this site. Okay, let's flash in the future from that last series of x-rays. That's when the patient started, and that was about 3 years ago or so. This is now a current x-ray of today, but this tooth here that we're talking about was restored about a year and a half ago, so maybe just under a year and a half ago. So we did some sinus lifts with graft material, let that heal. We then had enough material there. We placed an implant and added more graft material. So the bone has turned over now around the implant and has taken it in. And now we have a moderately, not the biggest, longest implant, but a moderately sized implant to hold that particular tooth in that particular bone area into the sinus. And what it looks like is this. So here's the sinus bone that's now around that implant. Some of it you probably can't see, but it's holding in, it's hard bone. The patient's not really has a lot of thick bone anyway, so that this has been holding for the past year and a half or so. I don't know the long-term consequence or like the long-term success rate of this tooth in her mouth. You got to remember that just because I have this in here, you want to wait at least 2 to 3 bone healing cycles. Now that we're about 3 bone healing cycles through this case, I can expect that that bone is going to stay, meaning it's keeping up with her forces that she bites on with, but it's also keeping up with the remodeling of her bone. If the remodeling of her bone, let's say you're osteoporotic and you don't recycle your bone very well, and you don't build bone very well, this will eventually come out within about a 2 to 3 maybe bone healing cycles later. So the 5-year success rate goes way down because we're only talking 1 year. This has been in longer than that, and it's holding fine. And she actually has crowns down below here that we did implants on the bottom that made this successful for her. She probably doesn't chew very hard anyway, so that's a plus. And as long as she takes care of it, I would expect that now that we know that her healing is occurring around the implant at a normal rate that's holding this in, I would expect that the little bit of stress that she's putting on this crown help maintain the bone as well. Bone reacts to stress, but it reacts negatively to too much stress if the bone cycling isn't keeping up with the stress that's getting put on it. Does that make sense? So this is a successful case. It's a very difficult case to get to work, but this makes that red case a little less red. So I would still put this into a yellow until we're like 5 years into it. If we're 5 years into it and it still looks like this, then we're talking green. But I would say it's still cautionary because we're still under a 5-year period in making sure that we have things healing.